Well, cases of coronavirus in this country are now at their highest level since April. The U.S. not only recorded its biggest single-day increase in 2 months on Tuesday, but also its third highest total of any day since the start of the pandemic. And unlike the first time when we hit this, it was all concentrated in a region. It's a little more spread out. Florida keeps breaking records, and it just broke another. That state recorded 5,500 new cases in the last 24 hours. And cases keep climbing in Texas as well. It recorded over 5,000 new infections for the second day in a row. Let's bring in Dr. Ashish Jha, director of the Harvard Global Health Institute. So, Dr. Jha, at this point, I guess we're starting to see the second wave. Something you said last night caught my ear, and that is, as we're watching the lagging indicator, that is the death total here. Number one, you thought we still were undercounting deaths. Explain.
Yeah, so Chuck, thanks for having me on. There's lots of evidence that we have undercounted deaths, that many people died during March and April and May who got very sick, couldn't get a test done. And then after they died, they weren't tested. And we've seen this in the excess mortality analyses that the CDC and others have done. Dr. Fauci has talked about this. And so while 120,000 deaths is an astronomically high number, it's awful. It unfortunately probably underestimates how many Americans have died of this disease.
By how much do you think? And is there is this something that we're just not going to be able to know until we do death certificate comparisons, for instance, a year from now?
It is going to be hard to quantify. We don't know. I don't know. Some people have estimated that maybe the proportion of people who died, maybe, if we could count all of them, our numbers would be 30 or 50% higher. So it's not a trivial, we might have missed a few here or there. It's going to end up being sizable. Right. It's hard to speculate exactly how many.
Dr. Jha, the president's going to continue holding indoor rallies where the majority of people are not wearing masks. They're not practicing social distancing. What sort of spread are we likely to see from that?
Yeah, what's funny about this virus is there's enough idiosyncrasy in terms of who spreads, when they spread, that, you could imagine one or two rallies here or there, which may not end up causing major super spreading events. But it's sort of like taking really big gambles. You're going to end up getting caught every once in a while. And what I'm worried about, especially since the president seems to be doing it in places that have large outbreaks happening already, is that one of these or more than one of these rallies is going to spread, or is going to be a super spreading event, is going to sicken hundreds and hundreds of people and maybe even lead to some people dying. Obviously, we all hope that doesn't happen, but the president doesn't seem to be taking the steps necessary to reduce that risk.
So what is the outlook here for the rest of the summer? I know there was some thought that if you're outside, that it's harder to spread this. Summertime months, people go outside a lot more than they do in the wintertime. But then there's also the issue of when it gets so hot, people go inside to get the AC. So, what are your expectations for what's going to happen this summer across the country?
Yeah, so we do have, I think, reasonably good evidence. It's not, foolproof, but that being outside is safer than being inside. The challenge is, as you said, that large parts of our country during the summer can get pretty hot, and people are not spending that much time outdoors, especially in the middle of the day. And so, the bigger picture point is that this idea that we've had that the summer would somehow make the virus magically go away would be no big deal. I think we are learning quite quickly that is not the case. And whether it's the summer or fall or winter, we have to understand that if we're going to spend time indoors, we've got to wear masks, we've got to do social distancing, or we're going to see large spreads of the virus.
Dr. Ashish Jha, it feels like deja vu all over again. I feel like in some ways we did this before. We talked about this, right? And all of a sudden it's like, well, I guess there's another part of the country that still needs to learn these same lessons. Anyway, Dr. Jha, thank you.